Welcome everybody to our weekly session on the latest dealings with COVID-19 pandemic with the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I am Chuck Carney, Director of Media Relations for Indiana University, and as always, we are joined by Bloomington Mayor John Hamilton. Also, we will have Monroe County Commissioners President Julie Thomas, IU Health South Central Regional President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU's Assistant Vice President for Strategic Partnerships and the IUB COVID Response Unit Head, Kirk White. And so we will start out with Mayor Hamilton for some opening comments.
Thank you very much, Chuck, and thanks again for everybody being here. Just brief updates, as we always do. I report we'd had several weeks with no sicknesses in our employee list, but we did have another City of Bloomington utility employee test positive, so just updating about that. That brings to about 13 the total number since the outbreak of March, but they are doing well and we wish them well. I can also report the City of Bloomington Utilities is conducting the sewer system testing. They've been several weeks into that. They're going to be sharing that with us. They have shared that already, some with the team, the health team, to look at that. It is an experimental program. We have found a lot of the data tracks what we know from other data sets, so we'll be using it to kind of confirm that, though I know that the group that is doing the testing, including some academic settings, are careful about publicly releasing it. So we'll be doing what we can to release that publicly, but it is confirming a lot of the other things that we've seen. For example, the significant increase in the congregate living areas showed up in the sewer system as well. It was very good to see the report from IU, Indiana University's dashboard on Wednesday with declines, modest declines in all the major sectors that they measure. So we're very pleased to see that. I really would just say to the community that every week that we keep going is good news, in that we are continuing to do what needs to be done to keep improving. It is still 50-50, if you will. We could turn on a dime. We've seen that around the country, but it is good each week to be able to continue. We will retain the city emergency order, executive order on social gathering size. That's been important, we believe, to continue to try to tamp down the spread and work closely with our partners. We appreciate all the work that's being done. Just also for what it's worth, the pilots that we've been doing with downtown businesses are also popular and seem to be working well. So we intend likely to continue those past the original date of September, assuming things go as planned and continued. So thanks for everybody doing what you're doing. Keep the masks, keep the distancing, keep the hygiene, and we appreciate the work together as we get through another week. And continue to move forward with all the efforts on that you see around you. And I'll hand it back and answer questions at the right time. Thanks.
Okay, we will go out to our live location again, Julie Thomas, again at the Hoosier Hills Food Bank, and she will join us on location.
Hey, Chuck, can you hear me?
I can.
Great, excellent. Thank you so much. I'm here on behalf of the Board of Commissioners at the Hoosier Hills Food Bank, and we have Penny Giffens, County Commissioner, and Commissioner Lee Jones is working on the farm today, producing more great food. A couple of quick things. We are continuing to offer CARES funding for businesses and social service organizations around the county. So if you have a non-payroll COVID-related expense that has not already been covered, please go to co.monroe.in.us and fill out the form and send us the receipt. As of yesterday, we have over $89,000 going out to support our local businesses and a little over $26,000 for the Monroe County Public Library as one of our taxing units. Also, we worked with the council to create the Township Assistance Program. So if you are struggling to pay for the essentials, rent, utilities, things like that, please contact your township trustee. Every county resident has a township trustee. They have additional funds available to ensure that everybody gets helped out. It's important that you reach out to them, though, for that assistance. Go ahead. Hi. We're out here today with the National Guard again, and with a lot of volunteers from Crane, along with the fabulous staff at Hoosier Hills Food Bank. Today we've distributed food to over 800 households so far. We'll still be here until 3 o'clock for anybody that is anxious to get out here. It's going really smoothly. Great crew today, I think. Yeah, it's fabulous. We also want to remind people that they need to respond to the census. If they haven't done so already, please either answer the knock at your door or go to go to 2020census.gov. For each person that we get counted here in Monroe County over the next decade, it can make a difference of $250,000, and that's money that goes for roads, it goes for the library, it goes for schools, it goes for the health care that we've all seen how critical it is to have that. So please, if you have not yet responded to the census, please do that. And thank you to everybody who's out here today. It's just really good. It's been amazing. This is unfortunately their last Friday of distribution here, but there are many other opportunities around the county to find food banks. So just contact the Hoosier Hills Food Bank online and they will assist you. Just a last quick reminder to everyone that I know that despite the pandemic, there's still an election coming up November. So please remember to check your registration, and you can do that at indianavoters.com. And you can also find other information. For example, if you want to be a poll worker on election day, or information about early voting or absentee voting by mail, all of that information is at monroecountyvoters.us. And so if there's any questions, just let us know. Thank you.
Okay, let's next go to the Monroe County Health Department and Administrator Penny Caudle.
Good afternoon. Thanks for having me again today. I just really have a few things, and for the most part, I think they're all positive. So we are starting to see our numbers, I'm going to say, rebounding a little bit if people are watching that dashboard. We've talked the last few weeks about the state having some difficulty systems talking to systems, and that seems to be resolved, and if not completely resolved, it is almost completely resolved, but I think it is in good shape. And today our positivity rate was 7.3%, so that is coming down. That's a 7-day rolling average, so it does look backwards, right, over the past week or so. And we'll continue to watch those. The state has indicated, as I've said before, gotten confirmation, we will be able to get a report on what the total numbers are, and then kind of break out the community at large and the university, so we can see that information in different ways. That may actually even be on the dashboard. I am not certain exactly how that will be at this point, but Dr. Weaver did mention that that may be on the dashboard, the state's dashboard as well. So we'll be looking forward to being able to look at that, even more data on the state's dashboard as they upgrade that as we go forward. The positivity rate does capture a picture for that past week, and it gives us all of the tests. So from week to week, we can see what virus might be circulating in the community. So even when people may test more than once over a period of time, it's important for us to know if that individual, maybe they tested a month ago and they were negative, but today they're positive, or they're still negative. That's still good information for us to have. So we look at all kinds of different information. The color-coded map is only updated once a week. So I would just caution everyone that, that's updated on Wednesdays. And so whatever the information is at that time is going to stay up there until the next week. I think they pull the information from Sunday, so they have Monday and Tuesday essentially to go through that information and get that up on the website. We do continue to have testing opportunities in the community. Our Optum site is one of 2 Optum sites in the state that are seeing a large number of really repeat people getting tests repeatedly. And so I just wanted to take the time to say there really isn't a reason for the average person to go in every week and get tested. Certainly, if you are symptomatic, you want to get tested. If you feel like you have been somewhere and you may have been exposed, maybe you took a risk you wish you hadn't taken, then wait 5 days or so after that and then go get tested. Certainly, if you develop symptoms, go earlier than that. But in general, there's not a need to just do weekly testing for the average person. I also want to make note that the Optum site does take lunch and dinner breaks. Now they are open 8 to 8 and they take very short breaks, but they do close during those times. And our site has been seeing 3, sometimes 4 times the capacity that they're expected to see. And that sometimes has caused some issues, but they have test kits and they are ready certainly to continue to serve the community. So we're anxious for that to continue. I do also want to say one other thing, just a reminder that if someone tests positive at any location, there's not a need to go to a different location and take another test. You're positive, and if you are a close contact, you may get tested. That will help us know if you are positive. If we find out that you're positive, then we can do your contact tracing, right? We can find the people who you may have exposed. But testing negative does not stop quarantine. So if I am a close contact to somebody who is infected with COVID-19 and I need to quarantine, that is a 14-day period in which I may, during that time, become ill. And that doesn't change because I could test today and be negative, but I could, in 3 or 4 days, then I might become positive. So you cannot test out of quarantine. So just kind of throwing that out there because I know we hear sometimes that people think that if they had a negative test that clears them from that. In terms of the Board of Health met this past week and they did update the communal facility regulations. Not a lot of big changes, but they did make a few changes. Those are posted on our website for anyone that wants to take a look at those. And the board meets again, they recessed and will reconvene on October 6th. We are continuing to work on plans for vaccines. For flu vaccine clinics are planned. Our public health nurses have 44 clinics planned, most of which are schools. And the word is, yesterday when I was talking with the state, that there is a huge increase in flu vaccine requests. And so we're pleased that hopefully that's an indicator that people intend to get their flu vaccine this year, that people are getting their flu vaccine this year, and we would encourage that. We are making plans for how we will distribute COVID vaccine once that comes, but we really don't have a lot of solid details at this time. And as that unfolds, we will certainly share that information as we come into 2021 and learn more about that. But we are watching that very closely. And I think that is it. Just happy Friday to everybody.
Okay, thank you, Penny. Next, go to Monroe County Emergency Management Director, Allison Moore.
Good afternoon. I'd like to report that we are giving Election Central 1,000 masks. That will be a start, and hopefully that will cover all of the polls as well as early voting for anyone that would like to participate in this year's election. We highly encourage that, and we want to make sure that everyone feels safe. And so they will be there readily available. And of course, we have plenty more if they need additional beyond that 1,000 that we're giving them. We still have 6 spots open for our September 29th blood drive. Normally we have this, when we're this close out, our spots have been full. So I am encouraging anyone that can make a donation to go to the redcross.org website and sign up for one of the 6 time slots that are still available. They are doing the antibodies testing. It is a very quick turnaround with the Red Cross to get those results if you make that donation. And they also are trying to offer a little bit more encouragement to get those spots filled. And so there are some gift cards that are going to be available for those that sign up and that then can make the donation. So I encourage you to do so if you can. My last announcement is I'd like to just let you know that we still have masks available for anybody in Monroe County that does in fact need a face shield or a face covering mask, and we have those at various spots throughout the county. You can find those locations at our website, which is co.monroe.in.us. And that's all I have, Chuck. Thank you so much.
Okay. Next, go to Indiana University and Kirk White.
Hey, good afternoon, everybody. As the mayor mentioned, we're pleased that we have a downward trend in all areas at the campus. In particular, our overall mitigation testing for the week of September 5th shown the results that the positive rates went down from 77.5% the week before to 4.7% the week of September the 5th. So this is a good trend for us. It shows that the community efforts to do communications and the efforts that we've been doing on campus, particularly with the student community, is settling in. And I think students are understanding the kinds of things they can do to keep themselves and the community safe. And we want to keep that trend going. In particular, with some of the populations we've been watching closely, just to note that the Greek letter organizations went from a 25% rate down to a 15% rate. The residence halls went from 3.6 down to 2.5, and general off campus went from 3% negligible down to 2.9. We're going to continue this high tempo of mitigation testing. We expect to continue at least 10,000 tests a week. This week we started to make sure that we've tested 100% of the residential programs and services, all the dorm residents. And we want to continue that through the remainder of the semester at 100% per week of those residents. I would then say that we really need to talk about how, for our population, with the structure that we have set up for the mitigation testing, that testing is a good thing, that it's not something to be scared of, to be afraid of, or to be afraid of the results. What we're finding, which is troubling to me and really saddening to me, is that, and for many of our student affairs people that are working on this problem, the level of testing is causing the students a lot of anxiety, because they get tested and then they've got 2 days to wait to see if they test positive. It's like any other medical procedure you'd have. You're waiting for the results. And that's what's happening with our student populations, is raise this level of stress throughout the campus, where all of our students are nervous about their results and mindful that they need to maintain a safe level. So putting it together, it's a struggle for many of our students to do this. And we just want to let them know that this isn't some kind of punishment that the university has come up with to force them through these lines of testing at least once a week. It's a positive thing. It's positive because it allows us to find where there are outbreaks and to get people in quarantine and isolation. And so we want this expectation to continue, that it's going to continue. We're going to continue this level of testing. It's not a bad thing. It's a positive thing. It keeps us out of trouble, and it keeps us to a point where we can continue campus operations. So we're glad to be able to do it at that level, because it appears to be working. And other campuses, other universities are calling us and asking us what some of our models are, which is encouraging as well. So my last point is, as I mentioned last week, let's fight the tendency to get into pan fatigue. Pan fatigue. This pandemic fatigue thinking that, well, it's just a way of life now. Yes, it is a way of life, but we've got to keep the standards high. We've got to do what we've been doing and learned about doing since March. This is a long fight. We've got a long way to go. It's going to be next year before we can change a lot of the things that we've learned. I was particularly disheartened to see this morning that a group of Indianapolis city councilmen are petitioning to relieve the city in Indianapolis of some of the masking requirements. Well, that's the wrong way to go at a time like this, in our opinion. So with that, let's keep up the good work and hope for another good week this coming week. Thank you.
Okay. And then we'll go to Brian Shockney from IU Health.
Chuck, thank you all of you for all you're doing. I want to begin by just making sure you all are checking in to be sure that you're well and that your neighbors and friends and coworkers are well as well. So are you asking them how they're doing? Are you checking in with them daily? Are you checking in with them when they may be a little quieter or maybe struggling or maybe working from home? I just encourage you to do that. We continue to do that here at Indiana University Health, connecting and making sure that all of our team members, as well as our leaders, are doing well. So I just encourage you to do that. Let's look at our data. Our data is a good news here. Although IU Health has conducted 75,000 virtual screenings and COVID-19 visits, we've had over 217 statewide tests. And here in Monroe County, as you can see, we have leveled off again, but at a lower level than we were before. We're very pleased to see this. We still have COVID inpatients in our facility here in Bloomington, also in Bedford, Indiana, and several still pending, but we're liking this trend. It is just indicative of what we're seeing in the community with wearing masks, and specifically with IU and their great policies that they are putting in place. Here you see the week positivity each week, and you can see that's in a good trend as well. As you can see in this next grouping of data, I just wanted to share that if you look at the top two charts here, in the spring when the pandemic hit Indiana, the infection was spreading among our 50 and older population. In the summer, the age breakdown of identified cases changed, with a large group of our younger population getting the virus. However, if you look at the deaths in the bottom two graphs, there's virtually no difference in the age breakdown of people who succumb to this virus in the two periods. This virus is a disease that is discriminatory in terms of its impact on our elderly population. Lastly, we identified twice as many cases in the summer than in the spring, but the deaths were only half as many. Almost certainly that's from increased testing rather than because fewer identified people. So just want to keep this in perspective, that this is about protecting others as well as ourselves. So which leads me to my last point, which is wear because you care. In tandem and in support of many of our community campaigns to encourage the wearing of masks and practicing best practices related to the virus, we've launched a new campaign called Wear Because You Care to help motivate people across the state to wear masks out in public. Specifically children who fear sometimes wearing masks, and it seems foreign to them. This messaging encourages people to wear masks not only for themselves, but for their communities and their loved ones. After all, we're fighting in this together. And I will end as I begin. I just ask that you check in with your neighbors, your coworkers, your friends, not just those in your community, but those that live in other communities and other states, to be sure that they are doing well. Thank you, Chuck.
Okay, we'll be happy to take questions here, and we do have some that have come in. So This is a question from the B Square Beacon for possibly Mayor Hamilton, but probably Julie Thomas. He says, has the Canopy of Lights been game planned at all for this year? I'll assume the lights will still be up, but is there any scenario where there would be some kind of in-person gathering for the flipping of the switch? Surely the city or the county could apply for an exemption to exceed the gathering size limits.
Can you hear me?
Yes.
Okay, great. So I would say that it's something that's on our radar, and we're definitely going to have to look at that, try to figure out some way to celebrate the holiday season and to celebrate with our community, and it may have to be done virtually. So we're going to work with Downtown Bloomington Inc. on that, and I'm sure whatever it is, it will still be special. Great.
Yeah, I would just add we've got Halloween before that we'll be working on, and that's it's on the table. And I know we've reached out to Santa Claus just to check his plans. We're trying to figure that out for the day after Thanksgiving. We'll figure something out, as the commissioner said.
Next question, again from B Square Beacon, this one for Penny Caudle. You said there's no reason for the average person to get tested repeatedly. Are there any non-average types of people for whom it would make sense to get tested repeatedly?
Yeah, Dave, thanks. I guess my point about that is really that testing is not prevention. And we, certainly want people to test when it's appropriate, but for people who are not changing behavior and just testing repeatedly to see if they're infected kind of defeats the whole purpose of what we're trying to get at. So we want people to practice prevention, to wear that mask, to maintain that physical distance, wash their hands, all those kinds of things. There may be some situation that would be between maybe a doctor and a patient that might indicate that they want someone to be tested more frequently. But in terms of our testing sites, my point is really just let's be practicing and mindful of the prevention that we need to take, and then test when it seems appropriate that something didn't work. The other thing that I would say is, for instance, long-term care facility workers are supposed to be testing regularly now, but that's to be done within their facility, and again, not at community sites. So those were the kinds of things I think that I was trying to address.
Okay. This one from Ethan Burks from WFIU WTIU for Mayor Hamilton, with the local income tax, or local LIT. I forget. I apologize. The LIT stands for
local income tax.
Okay, I thought that was wrong. And with that increase failing to pass a council vote earlier this week, is there a new strategy your office is working on to generate more funds as the pandemic continues? Is there any room in the upcoming budget to address issues the tax would have covered, and what's your overall reaction to the vote?
Well, thanks. I was disappointed in the vote, as you probably would expect. I should probably put it in context in regard to this question, though. With the Recover Forward program, which we have announced and talked about, there are really 3 phases. And the first 2 phases we're covering this year, the rest of this year, 2020, which the council did support a $2 million appropriation a few weeks back, which is very important to invest in pandemic recovery, both economic, health, and other angles to that. Stage 2 is the 2021 budget. And that is in front of the council now, and they'll be voting on that by mid-October, we expect, to include a bunch of investments and efforts to help the community move forward. The local income tax proposal was really focused on kind of the long-term ongoing investments that are needed, because as I've probably, you've heard me say before, it's not only recovering from the pandemic and investing in ways that protect our people, help our people recover, help our community recover. It's really trying to recover in the right way toward more economic equality, more racial justice, and more climate justice as we move into the 2020s. So I was disappointed in that vote. I was encouraged that the council members overall, we're very supportive of those kinds of directions, and we'll keep working on that. But the short answer is yes, the upcoming budget for 2021 does include a whole range of investments to help the community recover. And it's probably worth noting, I know most of you know this, that a good issue in the General Assembly coming up may well be Indiana's overall investment in the public health network. We are among the worst funded states in the country per capita for our public health network, and we have heroes mightily struggling every day, some of whom on this call, to do all that we can, but it's certainly worth revisiting that kind of basic infrastructure investment at the state level, which will help a lot of this too. Thanks.
Another question from Ethan going to IU. There have been recently a few national reports highlighting a massive rise in the college dropout rate during the pandemic, particularly among students coming from low-income families. Is IU experiencing any of that or seeing that trend?
I've not heard that brought up as a discussion point with university administrators that staff meetings that I've been a part of. I think we're still counting total census. It's always a little difficult to tell what your total census is going to be until that first payment's due, frankly. And so from what I've heard from enrollment services, things are pretty steady according to what we expected to happen. And we'd have to get back to you with some more specifics on that. But I've not heard of a particular increase in the number of people leaving or leaving our residence halls for that matter.
Yeah, and it's also, there's a phenomenon in higher ed parlance called MELT, which is when people intend to enroll, they do enroll, or they leave in the first week or so of the semester. It's very difficult to pin down exactly all the reasons for that. Sometimes we do explicitly ask, but that's something that probably is going to be able to be written about better historically than recently as we sort of move through the pandemic. I think it's fairly fair to say. This again, Kirk, to you from Emily Ernsberger from the HT. With the increased sense of anxiety across the campus, and she notes parenthetically, and the city, is there an increase in CAPS visits from students and staff?
Yeah, Emily, that's a good question, and the answer is yes. Unfortunately, counseling and psychological services, as you mentioned, is a part of our student health center. And just as Brian Shockney has mentioned over the past month or two or several months, there's been an overall increase in the demand for mental health services. We've seen that particularly true as well by our students who visit our CAPS facility at 10th and Jordan. We have virtual visits going on. We have some support groups going on. I know that there were some vacancies over at the health center this summer, and even though we're in a hiring freeze, when Provost Rubel found out about those, she immediately said, we'll exempt those from the hiring freeze and get those positions filled. So we're trying our best to keep up with all that, but there certainly is a higher level of anxiety and those kinds of manifestations that high levels of uncertainty bring, and that's really where we are in all this, not just on the campus, but in the community and throughout the country. I have not checked about staff, whether they're using a higher degree of our employee support program that we have available that provides several free visits for staff. But I can check on that to see if we've had an uptick in those requests as well.
And one thing to note, we've referred here to a Friday email that we send to students, and also we send a separate one to faculty and staff. That Friday email to students today is focused almost entirely on this mental health issue. This is something that we've heard from parents who've called in, from others. I myself have received some emails from folks who are concerned about that. And it will be going in the faculty and staff email as well, told by Amanda Roach of our team, and that will also focus on mental health. It is something that is an emphasis point for sure, as we try to make sure that we address those issues that certainly we're all experiencing. Mayor Hamilton?
Just to add, and of course, the HT has done some good reporting on this locally, the major increases in off campus, but the city mental health services that they've reported. And I just want to give a shout out to Centerstone, which we've worked with over the last several months to provide additional services to our employees as well. And I know our resident advisor, Mr. Shockney, helps remind us how important taking care of each other is. This is National Suicide Prevention Month, and we really appreciate all the services that are there in the community and everybody who's trying to help stand them up, bolster them up, the philanthropic community that stood up so strong to help all that. It is really important from campus to city.
So I am going to do my vamp here. We have about 8 minutes left, but I'm not seeing another question, but I bet that there will be another one that will come in. A reminder from the IU front that we are updating the dashboard that we unveiled about 3 weeks ago now on Wednesdays, and that is generally going to be on Wednesday mornings. So if you, we did do those on Mondays to begin with, but we are doing it on Wednesdays, and that again is to get the full context of a week of data, a week of tests, so that we can get that in there in that dashboard week to week.
Yeah, so, Chuck, that's right. It does. We test Monday through Friday, and then it takes a couple of days to get the results. So we're able to crunch those together starting on Monday to get the final ones from Friday. And that helps us get things sorted out and in the right boxes so we can get that published on Wednesday.
Okay. So I'm going to make a call going once, and I'll give you just a bit more here. So we still have technically more time. This was when I was a journalist, I always practiced, if you had a deadline, use every minute you had up until the time was up, because otherwise you're giving away time. So, and in that vein, Dave Askins has a question. Is there any hope or expectation the massive testing at IU will factor into research studies on the spread of disease? That's a good question, Kirk.
That is a good question, and I'll have to find out about that. Certainly, the medical team that we have managing this from the School of Medicine are all on our research faculty, and in addition, we've had plenty of interest by our public health faculty that have advised us as well. So I'm almost certain that they're going to, this is a professional experience for them. And we're just lucky to have the resources that we do from the School of Medicine. Most of the faculty that are working on this are also faculty members that work in other parts of the world. In our Center for Global Health, work in other parts of the world at times, particularly in Kenya, studying epidemiology and the spread of these viruses and other epidemics. And so I'm sure this will blend into their work, and the results will be seen. And I also got a note here. Amanda's going to be sending a copy of that newsletter to Emily, so that Emily can have the same information that we're sending out this later today, to talk about the mental health issues and what we're doing to support those, not just with students, but of course with our faculty and staff as well.
Okay, and it's along the point of the research. I think, and I should look this up, but I think there actually have been a few very quickly turned around papers on the early part of this. One of them that comes to mind has to do with masks that have some copper as a part of the masks that can theoretically kill virus on impact. That involves an IU research team. So there will be, Mayor Hamilton notes, there's going to be buckets of PhD theses written all over this with the data, and there's going to be a bunch of data out of this. So we certainly all are learning more about this.
Well, we really are, Chuck. You know, by the day, I see improvements at the university and how we're responding and planning for the future. But I see that also in the community and the state. We're improving as we go, and that's giving us all a sense of hope and a sense that if we are infected, there's a greater chance that we'll be successful and recover, and hopefully avoid being infected in the first place. So there's a lot of great things going on and a lot of hope in all this. And speaking of the future, we're already thinking about, of course, I mentioned the flu shot clinics for the whole campus, but then the vaccine, perhaps after the first of the year, and then what our arrival testing will look like in February. So I'm just excited that at this point today at 1:59 p.m., we're talking about second semester, and that's great.
Okay. Well, we'll leave it at that, and we will be back next week again at 1:15 and talk about the latest in the COVID-19 battle, and we will see you then. Thanks, everybody, for being here.
Thank you.
Thank you, Chuck, and thank everybody.